Okay, so this is our final cut of our case study challenge. Our protein was Plasmodium falciparum erythrocyte membrane protein 1, otherwise known as PfEMP1. So you are a doctor and a patient comes into your clinic. He has a fever, he's sweating, vomiting, and has a headache and chills. He recently visited Africa about 2 or 3 weeks ago. He visited Ghana, and you do some tests, and it turns out that he has malaria. So, what is this protein? So, it's malaria affects 300 to 600 million people worldwide. PfEMP1 is the apicomplexan parasite responsible for the deadliest form of human malaria, causing 1 to 3 million deaths a year, primarily in African children. It's transmitted by anopheline mosquitoes and replicates within the circulating red blood cells of an infected individual. The extreme antigenic variability and the great breadth in adhesive phenotypes within the PfEMP repertoire make it the principal virulence factor of malaria. The structural components of the protein, they are large proteins ranging in size between 200 to 300 kDa. The protein contains an N-terminal segment, variable numbers of Duffy binding-like domains, 1 or 2 cysteine-rich interdomain regions, a transmember domain, a C2 domain, and a conserved intracellular acidic terminal segment. This antigenically variable protein is placed on a knob-like structure on the surface of the IRBC and binds to different host vascular adhesions, including CD36, ICMI, BCAMI, and CSA. The cytoplasmic tail of PfEMP1 anchors to one of the proteins composing the cytoplasmic scaffold of knobs known as the knob-associated histidine-rich proteins. Once in the red blood cells cytosol, PfEMP is directed to a parasite-derived protein sorting site referred to as Mauer's cleft, and then traffic through the clefts to the IRBC's surface. Diagnosis. So, it can be pretty difficult. It's important to note when a patient comes in with these symptoms to know where they have traveled, because it's mostly prevalent in South America and Africa, or like the warmer climate countries closer to the equator. So it's important to note where people have been recently. Clinical diagnosis is based on the patient's symptoms and on physical findings at examination. In severe malaria, like one caused by PfEMP1, clinical findings are more striking and may increase the index of suspicion. These symptoms include confusion, coma, neurologic focal signs, severe anemia, and/or respiratory difficulties. Laboratory tests will always confirm any signs of malaria. These lab tests can include a microscopic diagnosis, antigen detection, molecular diagnosis, serology, and drug resistance tests. And for treatment, patients who have malaria caused by PfEMP1 should be given treatment by continuous intravenous infusions. There are also many drugs used in treatment that are active against the disease, which include chloroquine, malarone, cordum, larum, quinine, and a few more. In addition, primaquine is active against the dormant parasite liver forms and prevents relapses. And these are our references.